Assalamu alaikum, the clinical day. Your role, first scenario, your role is the senior house officer in the medical clinic. Scenario, Mr. John Adam, 55 years, referred to you with a complaint of tiredness. Please sit with him, examine the patient, and address his concerns. Okay, ready?
Okay.
Yeah, here you go.
Hello.
Yes, hello.
Is this Mr. John Adam, 55 years old?
Yeah, I am.
My name is Dr. Mahmoud, one of the doctor here in the clinic. How are you?
I'm fine, doctor.
I'm here today to discuss about your health condition. I might ask you some question and I might examine you. And at the end, I will address all your concern. Is that okay with you?
Yeah, sure.
Okay. So, Mr. John, I see that you are coming complaining of tiredness. Is that right?
Yeah, doctor.
Can you tell me more about that?
Yeah, doctor. I'm really tired, doctor. For the last 4 months,
Hmm?
I'm feeling unwell.
It sounds distressing for you, but I want to assure you that you will get the bottom of this. You told me that you have this tiredness for 4 months. Is this started all of the sudden or started gradually?
No, it was gradual, doctor.
Yes, and what do you mean by tiredness?
I cannot do anything, doctor. I feel tired and fatigued.
Mm. And this tiredness all over the day or related to specific time?
Yeah, all over the day, doctor.
Since the morning?
Every time.
Every time. So since you start in the morning, you feel tired, and this is affecting your daily activity?
Of course, doctor. It
And
start in the beginning. It was for buying the things, going out. Now, even for the daily activity, I'm feeling tired and difficulty to cope with.
are you working, Mr. John?
I was doctor, but I cannot go to my work.
And what do you do for living?
I was a plumber.
Plumber. Okay. And this is affecting your work, and now you are not going.
Yes. Yeah.
I just want to assure you that we can give you also sick leave till we'll get the bottom of this. Okay.
Okay, doctor.
And this tiredness, what about your sleep?
I sleep okay, doctor.
So, and when you wake in the morning, you feel yourself fresh, or since when you start morning, you feel yourself tired?
No, it's even I slept well, still I'm feeling tired. It's not related, doctor.
And did you sleep in? Do you have any nap in the day?
No, I'm sleeping okay, doctor. I don't have any problem with the sleep.
Okay. And what about your mood?
My mood is not okay, doctor, because of this tiredness.
Tiredness. Okay. We'll help you with that. And you told me you have this tiredness. I just want to ask you some question, yes or no, if it's associated with this tiredness. Okay.
Okay.
And you told me you have this tiredness. Did you? If this is this tiredness associated with any head pain or headache?
No,
Any blurry vision?
no,
Any difficulty in swallowing?
no,
Any weakness in any part in your body?
no.
And have you noticed any change in your weight, increasing or decreasing?
Yeah, doctor, you're right. I feel my weight decreased.
So you feel your weight is decreasing. Okay.
Hmm.
Have you noticed any fever?
Yes, doctor. Recently, for the last couple of months, I always have fever, and also I noticed some recurrent infection to my throat.
So you have recurrent throat infection, and you have also fever.
Hmm.
You are measuring your temperature, right?
Yeah, sometimes reach to 39, 38.5.
Okay. And
When I take some antibiotics, it improves.
you're taking antibiotic, and you are taking this antibiotic from yourself, or the GP give it to you
One time I went to my GP and he prescribed for me, then I took it myself.
yourself? And how many antibiotic you take? How many times?
Only one. No,
Only
for the last maybe, yeah, maybe 3 times.
3 times. And Okay. And apart from this recurrent throat pain, do you have also any flu symptoms?
Like what, doctor?
Like runny nose, malaise,
No,
body ache,
I feel body ache, doctor. Yes.
any night sweat?
No,
And you feel body ache all over your body, or when you have the fever?
when I have the fever.
When you have the fever, okay. And you didn't notice any lumps or bumps on your body?
No,
Okay. And what about your bowel habits? Any change
it's
in bowel habits?
yeah, doctor. I noticed recently it become more hard.
So it's become more hard. Okay. And any change in your of the diet related to that? You think it's related to that?
No, doctor. I don't think.
And what
My diet is okay and as usual.
and what about your appetite?
It's poor, doctor.
Poor. Okay. This is related to the tiredness that you have.
Maybe the same duration. Yes.
Okay. And have you noticed any weather preference?
No,
No. Okay. And okay. And have you noticed any rash on your body or pigmentation in your body?
no,
Any stool? Have you noticed that your stool is difficult to flush?
no.
Any thirst? You feel yourself thirsty all the time?
Yes, doctor. I feel thirsty.
You feel thirsty. Okay. And what about your urine? Any increase in frequency?
No, doctor. For the last month, I think it become more less and dark.
Okay. And have you noticed any pain while passing urine?
No,
Any heart racing?
no, doctor.
Any chest pain?
But it happened. It happened when I do some activity.
The heart racing?
Yes, I feel rapid heart racing.
But this was before, or this is unusual for you?
Unusual, doctor.
Okay. And okay. And what about any cough?
No,
Any chest pain?
no,
Have you noticed any bleeding from any part on your body?
no, doctor.
Any dark stool?
No.
Any joint pain?
It's not joint, doctor. Actually, I feel some back pain.
Back pain.
Hmm.
And you tell me more about this back pain?
It's like in the my lower back, doctor.
Hmm?
Yes, and it's not related to activity.
Incre- so it's not increasing with movement.
Yes, doctor. When I do movement, it hurts, doctor.
So okay, when you do movement, it's hurt. Okay, and this back pain is radiating to any part in your body,
No, only in the lower back.
only in the lower back. Okay, and have you noticed? You told me this back pain radiating to only in your back. Have you noticed any redness or swelling in your back?
No,
It's related to any trauma.
no, doctor. I never had trauma.
Okay, and okay, you told me. And I just want to. I will examine you, and I might ask you some questions.
Sure, doctor.
Okay. So, any recent history of travel?
No.
No recent history of travel. And I will. I just want to examine you. I will need to check the vitals.
Yes. Blood pressure is 120/8.
Hmm?
Pulse rate is 85. Temperature 37.
7. Okay. And I need to check the general appearance of the patient. He looked cachectic.
Yes,
He looked
cachectic and tired. Yes.
cachectic. Okay. And any pallor in the conjunctiva?
Yes, there is pallor.
Pallor. Okay. Any jaundice?
No jaundice, only pallor.
Only pallor. Any rash in the face or in the body?
No,
Okay, I need to check the throat for infection.
no infection.
Any pigmentation in the mouth or mucous membrane?
No.
Okay, and I need to check for proximal myopathy by asking him to stand from sitting without support.
He's saying, Doctor, I'm tired. I cannot even with support standing.
Okay, okay. So you couldn't stand. Okay, and I need to check the chest for any crepitation or any murmur.
No murmur and no crepitation.
Okay, I need to check the abdomen for any organomegaly.
No organomegaly.
I need to check the back. For the back pain, I need to check its tender.
Yeah, there is localized tenderness
Hmm.
at the level of lower back, lumbar area.
Any redness or swelling?
No.
Okay. I just want to ask you, Mr. John, do you smoke?
Yes,
How many cigarettes per day?
it's 10 sticks for the last 10 years.
Last 10 years. I highly advise you to stop smoking because this will affect your health and might increase your tiredness and you feel and all your tiredness. So I might refer you to the smoking cessation clinic if you are happy with that.
Okay, doctor.
And do you drink alcohol?
Yes,
How
at the
many?
weekend.
Only at the weekend?
Yes, occasionally.
Occasionally. Okay. And you told me that you work as a plumber. Okay. And are you the only carer for home?
Yes, I have my partner.
Hmm?
I'm the one, suppose I am the one supporting here, but now I need someone to support me, doctor.
I'm really sorry about that. We'll help you with that. We might give you some sick leave, and we might, if you have any, we can help you with that by give you some financial support by after reaching the diagnosis. Okay.
Uh-huh.
And just want to ask you, I just want to ask you, are you taking any recreational drugs?
No, doctor, never.
No, so good. Okay. So, what is your main concern, Mr. John?
Doctor, I'm worried, doctor. Is it cancer like my father?
Yes, that's why I want to ask you. Any one of your family has the same condition or has cancer?
Yes, I remember my father was having cancer colon.
Cancer colon. Okay. I really appreciate your concern, and I just want to tell you that cancer can be one of the differential. Okay. So that's why I would like. I will need also. When I will examine you, I need to check the thyroid. Any thyroid swelling?
No thyroid mass, no
Mm.
swelling,
Any lymph nodes?
no lymph nodes.
Okay. Okay.
What else you want to examine? Still, you have one
Yes.
more, one more minute before 2 minutes for the concern.
Okay. So I need to the thyroid. You you okay. I need to check check for any tenderness, any joint tenderness or muscle tenderness when I'm pressing to check for fibromyalgia. Any tender,
No tenderness, only tender in the lower back.
only tenderness in the lower back. Okay. So I have poor appetite. So I just want to ask you, do you feel any sick, if yourself sick or vomiting,
Yes, doctor, I feel sick nowadays.
and any vomiting?
I throw up last week.
Hmm?
I feel severely sick and I throw up already for food content.
Okay, it's how many times?
Like 3 times, doctor, for the last week.
And it's associated with blood?
No blood.
Okay. So, okay, and
2 minutes left.
okay, so Mr. John, you told me that you are concerned about cancer.
Uh-huh.
So I would like to run for you some tests to exclude the cancer because you might have cancer because you are feeling tired for 4 months and you are losing weight and you have your body defense is low because you're having some infection, recurrent infection. So I need to do for you some test and
Is it related to my water work, doctor? Why my water work being less nowadays?
it it could be related, but We need to do for you some investigation for that.
Okay, doctor.
Have you
Will you
noticed
add?
any frosty urine or only
Yeah,
this?
no, doctor. It was less only.
Yes. Okay. And you told me that you're not feeling you are feeling heart racing only on exercise, but you're not feeling sweaty or heart
No,
rest.
no.
Okay. Okay.
Doctor, I feel also dizzy while standing from sitting.
Mhm.
Is this something important or serious?
It could be also related to your condition. That's why we need to run for you some investigation, and I would like to admit you and check your blood pressure sitting and standing.
Okay, doctor, time is up. Present the case, please.
I examined this gentleman who's complaining of tiredness. He was having, and also he was having weight loss, recurrent infection, back pain, and also he was having constipation, thirsty, with poor appetite, having also a back pain. Putting this all together, this patient, my top differential would be cancer. It could be multiple myeloma, or it could be only multiple myeloma.
Okay, perfect. What other differential for this patient?
I asked him differential of tiredness. It could be fibromyalgia, chronic fatigue syndrome. But again, is this I couldn't appreciate any tender point, or and it could be related to obstructive sleep apnea, but it's not related. It could be also no, only these things, only these.
Yeah. What other cancer you can suspect in this patient?
I can suspect cancer pancreas. Um, 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 hyperparathyroidism, cancer pancreas, metastatic cancer.
Okay, perfect. Fair enough. What is the approach for this patient? Will you admit this patient?
I think this patient need admission
Mhm.
because we need to do for him urgent blood, routine blood to check with him. He look immunosuppressed and cachectic. So we need to admit him to do for him full blood count, renal function, liver.
What you expect in the CBC?
He might be anemic and
Okay.
leukopenia,
Okay.
and also I would like for him to do for myeloma screen, check the electrolyte, including calcium.
What you expect if you are looking for multiple myeloma? What you expect for the calcium?
Calcium will be high, and also MRI is back to check for lytic lesion, um, and fracture or metastasis.
What? Okay, good. What other tests specific for multiple myeloma you want to do?
I think it elect band some protein. Um, I forget some protein, but I forget the name in the blood.
Electrophoresis.
Yes, serum electrophoresis. Yes,
Okay.
MRI.
What in the urine? What in the urine? What test?
Then John's proteinuria.
Yes. Okay. What the invasive test you can diagnose with multiple myeloma?
Bone marrow biopsy.
Perfect. And what you have? What you might have in the bone marrow biopsy?
Plasma cells, B cells.
Yeah. And do you remember the percent?
Less than 5. I forget. Less than 20.
30.
High. 30. Yes.
30%. Yes. Okay.
30 B cells.
Okay. How you manage this patient?
This patient need a multidisciplinary team. Need admission, a multidisciplinary team, including the oncology team, the hematology team, and the nephrology. We need they might start for him immunosuppressive, treat hypercalcemia, treat any asymptomatic treatment for anemia also.
Okay. For multiple myeloma itself, how you can manage?
Chemotherapy.
Okay. You mentioned hypercalcemia. How you manage hypercalcemia?
Hypercalcemia by giving fluids, biphosphonate. We can give also calcitonin, and there's another medication I forget. It's I forget.
Any role for steroid in multiple myeloma?
Yes, I think steroid for hypercalcemia also can be treated.
Yeah, both in multiple myeloma and hypercalcemia.
Yes.
Okay. What is the definite management for or treatment for multiple myeloma? Last
The,
question.
the name of chemotherapy?
No,
Radiotherapy? I don't know.
no. Definite management
Definitely.
or definite therapy or definite treatment.
I know only the chemotherapy. I don't know the name even.
Okay, suppose this patient young. Do you think about any transplant for him?
Yes, bone marrow transplant. Yes.
Yes.
Hmm.
Okay, stem cell transplant. Yes, it's stem cell, not bone marrow. Stem cell transplant. Okay, well done, Dr. Sarah. You reached the diagnosis. I will put the skills and the grading. What do you think about the performance?
I got the diagnosis at the end. I forget about the multiple myeloma to relate together.
Yes, you have to correlate all the symptoms together.
Yes.
Can you give me the manifestation of multiple myeloma?
It was a abbreviation of something, but I forget it. You can say
Crabby. Crabby. It was crab, but they added I now recently. So it's crabby. What are
it.
the crabby?
Calcium, hypercalcemia, renal,
Okay. Okay.
anemia,
Anemia, yes.
hypercalcemia,
And
hypercalcemia.
hypercalcemia and
No, I forget.
two remains. Two. You mentioned two. You mentioned both of them in the history.
Yes, anemia, hypercalcemia, lytic
Yes.
lesion, and
Okay, bone. B for crabby. C for calcium or hypercalcemia. R for renal failure. A for anemia. B for bone lesion. I crabby. The last one.
no, I don't know.
I mentioned it in the history. Patient had recurrent.
Infection.
Exactly. It's
Mm.
okay. So let's go to the mark. So for the physical examination, did you examine the patient all steps needed? Do you think?
Because I didn't know the diagnosis, so I tried to examine everything, but
Okay,
no.
but you had anemia from the history, and you had pallor. What you missed?
Mm. I checked the eye and I checked the mouth. I checked the lymph nodes.
Okay, related to anemia, what else you can examine for anemia?
Heart. I examined the heart.
Yeah, you examine the hearts and the hypertension, or sorry, and the blood pressure and the vitals. What you could
And,
examine? Push-up hypotension, right?
yes,
Patient is dizzy.
I think blood pressure standing and sitting. Yes.
Yes, exactly. So
Mm.
it's this one also will be in the physical examination.
Mm.
The heart as well, but you examine the heart for murmur. What murmur expected to find this patient?
Low murmur.
Yes, functional murmur.
Mm.
But you offer it. Okay, if this patient in acute heart renal failure, what you expect to find in the examination else? And you have to offer it. The
Mm.
volume status, right?
Yes.
He
Dehydrated,
told
yes.
you he has less, not dehydration. He might be overloaded. He told you I have less urine output, or he has less water work.
Hmm.
So he might be in failure.
Hmm.
You have to offer this raised JVP
Yes, yes,
and also, yeah, fine by basal crackles. You didn't offer all these things. So
yes,
what do you think about physical examination?
yes, it's not good.
Yeah. Although you have good time,
Yes,
I wanted you to ask about family history earlier. You asked
yes,
it
yes,
after
yes.
I remind you.
I should ask about family histories. But because I didn't get the
Okay,
diagnosis, I asked while examining the patient.
no problem. So I can physical fine examination. You miss a lot of things,
Hmm.
so we can say borderline,
Hmm.
and it will be from kind examiner. But other tough examiner, they might give you unsatisfactory for the finding. Identify the finding. Also, it's important to pick up the finding of multiple myeloma. You didn't miss the back, which is good. Lymph node for infection, good. The sore throat, you did also good. But again, you have to search for the all component of multiple myeloma, Krabi, and try to examine them by physical examination and to identify the finding by them. Again,
Yes.
it will be borderline.
Hmm.
Okay. Clinical
I,
communication as history taking. What do you think?
I think did it well, or no?
Yeah, you did well, but it was little bit disorganized.
Yes,
Yeah, so please finish the whole history before going to the concern. You ask the concern before asking about family history.
yes, yes,
Yeah, be sure that you finish everything in the history before going to the concern.
yes.
Clinical judgment, I can give you satisfactory. You got the case, although it was late. And you address, let's go to the differential diagnosis. Also, it was good, either multiple myeloma. And you said what else?
I said the pancreatic tumor or metastasis.
Yeah, and also you said bone cancer or metastasis, right?
Yes.
Yeah, it's okay for the differential. It can be satisfactory. The concern, when I ask you about cancer, what you said for the possibility of cancer in this patient?
I told him it could be cancer. That's why we need to admit you. But I told him
Yeah,
twice.
do you think it's could be or it's yeah, I think yeah, you confirm that.
I'm not
But is it
to diagnose it. I need to have a good diagnosis. So I couldn't say to the patient this is cancer. So I will tell him it could be cancer because we don't have the definite diagnosis for that. That's why we'll wait till the result.
yes, but you have family history of cancer. You have whole beta symptoms of cancer. You can
I
tell
told him it
him
could be
hyper.
most commonly you might have it, but we need
Yeah, yes. Yeah, most likely you have a cancer. Yes. This is
yes.
my point. You don't need to do the tests. Patient
Mm.
has a lot of finding which can alarm you for cancer. So you can say surely, yes, high possibility to have a cancer. That's why we have to do some blood tests to confirm the diagnosis and to rule out other differential.
And can you
Okay.
say the investigation for multiple myeloma?
Yes, you mentioned most of them, specifically the CBC for anemia,
Mm.
leukocytic count for infection, leukocyte, of course, inflammatory markers. If ongoing infection, you have to do.
Mm.
Then the renal function. You didn't mention the renal function. I don't know why,
Yes, I
but
said
it's one of the most important. Okay. If you mention, okay.
mm.
And
But Ben's John's protein,
electrolyte, full electrolyte,
yes, and immunoglobulin
full
what
electrolyte, IgM. By the way, he will lose most of the protein, so it could be all immunoglobulin deficiency, not specific one.
Mm.
Okay, that's why he has recurrent infection.
So we'll do what we called immunoelectrophoresis because I forget the investigation.
Urine and blood electrophoresis.
Mm. Okay.
There is zones between IgM and IgG, and all these protein, it will be shown in the figure, and from this figure they can diagnose the multiple myeloma.
Mm.
But the most important, you have to do Benz Jones protein and the bone marrow biopsy for plasma cells. And there is
Mm.
major and minor criteria, by the way. But to not to go deep more in the multiple myeloma, at least you have to know the main criteria of the disease, the main investigation, specific investigation, and don't miss the complication of the disease, hypercalcemia and the complication of calcium or hypercalcemia, ECG also, and echo, the heart failure signs and symptoms, chest X-ray, the bone itself. You can do also chest X-ray for lesion, sorry, X-ray, even MRI and PET scan. If you suspect metastasis everywhere, you have to do also PET scan.
Okay.
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 The treatment, as you mentioned, multidisciplinary team approach, of course, on the top of them, nephrologist, and you might also involve the oncologist for chemotherapy, because one of the management plan is chemotherapy. There is a regime for multiple myeloma, including one of the steroid in this regime, along with treatment of hypercalcemia. Patient might be in failure and he might need dialysis.
Yes.
And for, yeah, for also depression, he might be in depression. And if the patient is younger, we can think about stem cell transplant. And for the elderly patient, more than 55, they are not candidate for stem cell transplant.
Mm.
This is in summary and briefly about multiple myeloma. I read the case. I think it was in Jeddah. I don't know for Arab. Sorry, for Irish exam the day or the last week, maybe on Friday. I think multiple myeloma was one of the cases in the presentation in the exam. I think also Dr. Mahmoud joined us. He might get benefit from this case. Did you join, Dr. Mahmoud?
Yes,
Mm.
Dr. Bassem, I'm with you. But
Yeah,
Dr.
fast.
Bassem, why family history is important in multiple myeloma?
I know, I just put it as cancer in family history, not related to multiple myeloma itself.
Mhm.
But in the family with cancers, it will be positive for cancers. But it's not the same cancer as cancer colon. But I just wanted here to reach to this family history and to ask about it. It might be conclusive for another case, like a family history of cancer colon and polyposis. You should ask about family history in every scenario. And the cancer will be high possibility in patient with family history of cancer, whatever the type of cancer.
So, Dr. Bassem, this patient comes with loss of weight and
Yes,
decrease
tiredness,
tiredness.
loss of weight, anemia
Yes.
signs, pallor. If you ask me, anyone told you you are paler than before? Yes, my partner told me
And
uh,
he thirsty, patient,
thirsty. Yes, low
low
mood.
volume, low volume urine, recurrent
Yeah,
Mhm.
throat infection.
Mhm. Okay.
recurrent infection, and in the examination also there is pallor. You didn't ask about the tremors also, Doctor Sarah.
Why?
Fine tremors, fine
For
tremors for uremia.
mm, okay.
And the patient has back pain. Yes, Dr. Bassem.
Yeah, back pain.
Mhm.
Assalamu alaikum, Dagba.
Alaikum, Dr.
Walaikum
Azhar.
assalam, Dr. Hassan.
I
Yes.
also joined very late when the case was roundabout finished. In the investigation, I just want to add something
Yes.
beta 2
Yeah,
microglobulin
true.
and human level.
Yes, this is
Beta
for the
2,
grading. Yes, I you didn't mention. Yes, of course. You're right.
beta 2 microglobulin and what?
And
LDH.
albumin level. Albumin level.
Albumin. Okay.
Beta 2 microglobulin will be raised and albumin level will be low. And 24-hour serum and urinary protein electrophoresis and 24-hour
Mhm.
urinary Jones proteins. Regarding the treatment, the specific maybe examiner asked, what will be the treatment if the patient is more than 55 years melphalan, and then the prednisolone. And less than 55 years, if you ask what will be the chemotherapy, dexamethasone, bortezomib, and there's one more. So, and as you told that the final treatment is the specific treatment is stem cell transplantation. Only this was my comment on this case. Otherwise, you explained each and everything very well.
Okay, so the treatment more than 55, prednisolone and what?
More than 55 years, melphalan and prednisolone, MP. Remember, ME, melphalan and prednisolone. If less than 55 years, there are the three chemotherapy we are giving, like prednisolone, bortezomib, and the third one I forget at this time. There are three types of chemotherapy we are giving.
Bortezomib?
And
What's the names of the medication, sorry?
less than 50, less
Yeah.
than 55, bortezomib and dexamethasone.
Okay.
And there is one more. Three, we are giving one more. I forget.
Okay.
Maybe.
I think lenalidomide, Dr. Azhar.
Yes, thalidomide. Thalidomide. You are right. Thalidomide.
Yeah, okay. All of them are chemotherapy. Anyway, if the examiner knows this medication, they will be perfect.
Just a small point. I think
Yeah, sure.
the recurrent infection, not because of low protein, I think because of abnormal protein. They have high protein. If you check the protein, it will be high. The IgM and IgA especially it will be high. So it's
But
not
yeah, but insufficient protein, yes. Yes,
it will
you're
be
right.
abnormal. That's why it have the infections. Yeah.
Yes, yes. That's why they are calculating the total protein minus the albumin for the confirming diagnosis. Yes, you're right. Yes, thank you, Dr. Ahmed. One also point, yes, for beta 2 microglobulin, they are using it for the prognosis.
Yes, it is used for the prognosis.
Yeah, prognostic factor, yes.
And there's
Thank you,
there's
Dr.
a
Ahmed.
beta 2 glycoprotein, and this is in the which
This is
category?
for antiphospholipids.
Yes.
Since that day, I didn't forget it, Dr. Azhar.
Yes.
You remind me that day, because I mentioned the beta 2 microglobulin for the antiphospholipid,
Multiple
but you
myeloma.
told me no, glycoprotein and microglobulin. So there is difference. And
Yes.
yeah, thank you, Dr. Azhar and Dr. Ahmed. Any other question or comment? Any comment, Dr. Mahmoud?
No,
You have
thank
to
you,
learn.
Dr. Bass.
Yeah, you
Sure.
have to learn from these cases because you are the nearest one for the exam.
Yes, I think, Dr. Bassem, there is skin lesion in multiple myeloma. There will be lipoma.
I don't think it. Maybe for infection or
I don't know, but I
myelic.
think it is a criteria of multiple myeloma. It will be
No, the
lipomas.
criteria is crabby only. I don't think there is myeloma. Sorry, lipoma.
Yes.
I'm not sure if someone has the same information he can say. I don't think, Dr. Mahmoud.
Okay.
I also don't think that there's any skin infections or rashes
Yeah,
in multiple
maybe
myeloma.
skin infection or cancer skin, but for immunocompromised.
Okay, Dr. Bass.
Okay. Any other comment or question from others, please? Any comment? Can move to the next scenario, Dr. Sarah. Can you write?
I wrote it on the group, on the chat. Yes.
Okay. How do you do, Dr. Mahmoud, in your study?
Really good, Dr. Bass. Very good. Critical days, really.
Yeah, but the most important thing to sleep well in the day before exam. This exam needs more concentration and more relaxed brain.
Really, Dr. Bassem, I can't sleep. I don't know why. Really. 2 hours and wake up. I don't know why.
You need to take beta blocker in the exams. This is important things.
Mm.
You should.
Dr. Sarah is absolutely right. You must take beta blockers and you should have a very, very good sleep.
I
And
took
rest is best before test. Rest is best. You just have a test.
two 5 milligrams. You should
Dr.
take.
Mehboob,
Yes.
one day before, you should have complete rest. No need to touch any book. Just relax your mind. Go
Yes.
outside. Enjoy with your friend. Enjoy with your friend. So that you can perform good in the exam. If you will read till the exam, you will be overloaded and then you will be confused. Leave everything one day before. This is my
Yes.
personal experience.
Okay, Dr. Azhar. Thank you very much.
Inshallah. Everything will
Yes,
be
Dr.
very good.
Thank you, Dr.
Inshallah.
Sam.
Okay, Dr. Sarah, the candidate information, your role, you are the senior house officer on call for medicine. 20 years old woman has been admitted by ambulance to the emergency department after she developed left side weakness whilst at the hairdresser. GCS 15 out of 15 throughout, blood pressure 125/75, pulse 90 on arrival. Your task to assess the patient problem, address any question or concern raised by her. Okay, let's start.
You want to start immediately?
Yeah, but no patient name here, right? What's name?
1 second.
No name.
Um,
Okay, we can
no,
make it
Lisa.
Lisa. Okay, the same.
Her name Mora Donley.
No, Lisa better.
That's the actual scenario. But I don't.
No need.
Okay. Okay.
We can put a name. We can use this name.
Oh.
Left side weakness. Okay, we can start. So I'll set the timer. Hello, I'm Dr. Mukhtar, the doctor emergency unit today. You
Yes.
must be Mrs. Lisa.
Yes, doctor.
Miss Lisa, you are 20 years.
Yes.
We are here to discuss about your health issue. That okay?
Yes, please.
I read from your note that you have weakness. Can you tell me more about that?
Yes, doctor. Today in morning I went to the hairdresser because my sister's birthday is party today. And when I was trying, yesterday I didn't sleep well because we prepared for her birthday party. I was having some headache. I usually it's on and off headache, but in the morning when I was in the hairdresser, I started to have the severe headache. And also I couldn't. The hairdresser gave me a cup of tea, but I feel myself weak. I couldn't lift the cup of tea. So at the end, they called the ambulance and they brought me here to the hospital. But now I think that I'm feeling well and I'm able to move my hand.
Yeah, that's great to know that, and I'm so sorry for your suffering. May I ask you other questions, please?
Yes.
Is this the first time ever in your life?
Yes, this is the first time that happened to me by having this weakness. I don't know what's happening with me, doctor.
Okay, again, sorry to hear about that. And do you think there is something with the weakness? Did you feel pins and needles?
No, I couldn't. I didn't notice any pins or needles. But when I tried to lift the cup of tea, I couldn't lift it. So
And
it was my right arm.
so you feel weak in the right arm only, or
Only the right, only in the right arm.
what about your right leg?
No, nothing.
Nothing. It was only right arm.
Yes.
And it was floppy or stiff?
No, it was. I couldn't. Maybe floppy. I couldn't move my arm.
Okay, and you feel the weakness in the distal at the hand or in the arm side?
All over my arm, my hand, my arm.
Okay. And did you notice any abnormal shaking of your body?
No.
Nothing. Along with that, did you feel any headache?
Yes, I told you I was having headache. Usually I'm having my migraine already, but the
Mhm.
headache that I have it today, it was a different type of headache. It was in my center of my head, and sometimes to the right side. It wasn't similar as usual migraine.
Okay. And you have headache right now?
No, the headache. I took paracetamol. Usually I'm carrying paracetamol with me for if I have a headache, and I don't have this headache now.
And the migraine diagnosed with you for how long?
I have the migraine for 5 years now.
And what medication you are in?
I'm taking only paracetamol.
No other medication.
No,
Are,
I'm using some hot foments. It helped me with the migraine, but otherwise, hot towels I'm putting when I have the migraine. Try to have some rest, some simple analgesia only as paracetamol.
okay. Are you using them for longer duration?
No. Only when I'm having the headache.
Okay. Apart from that, sorry for this question. Are you using birth control pills?
Yes, I'm taking. I'm on oral contraceptive pills for 5 years now.
And what kind of them? Can you know?
Combined pills.
Combined one. Okay. You have kids.
Yes, I have kids. I have two children.
Okay. You have any sort of miscarriage?
No,
And how is your period now?
I'm on a combined pill, so my period is not regular. Sometimes I missed it for 2 months. Sometimes I'm having it, so it's not regular.
Okay. You have any pain, tummy pain during the time of period?
No,
Okay. I will ask you another question, and it might be irrelevant, but it might help us.
okay,
You feel any vision affection?
no,
Do you think that you can see things which is not real?
no,
Okay. You have any hearing problem?
no,
Any steadiness?
no,
You told me no pins and needles during the attack, but before or after any pins and needles?
no. I didn't have pins and needles.
Okay. And you didn't lose your awareness at all,
No,
now or before?
no,
Okay. Any infection in your mouth or your face recently?
no,
Okay. Any difficult swallowing?
no. I don't have difficulty in swallowing.
Any intolerance to any weather?
No,
Any chest pain?
no,
Any heart racing awareness?
no,
Any short of breath?
no. I don't have shortness of breath.
Any tummy pain?
No,
Any change of your bowel habits?
no,
Any joint pain?
no,
Any skin rash?
no,
Okay, you have any trauma recently or before?
no,
Any fall down?
no,
Any dizzy?
no.
Okay, you have any family history of same condition?
No, my mother was having stroke at 55 years age, and she's on warfarin now.
Okay. Apart from paracetamol and the analgesia you are taking any medication?
Only the combined pills.
Only that. Any history of surgery?
No,
Any allergy?
no,
Any travel recently?
no.
Okay. You told me only migraine you are diagnosed with.
Yes,
Sorry for this question. Do you use any recreational drugs?
no.
Any tattooing or piercing?
I have piercing in my nose and in my ear. But, I don't know. It's related. I did it since long time.
Okay. You told me also no signs of infection in your face or
No, I don't have infection.
okay. Do you smoke
I'm smoking 5 cigarettes per day.
and do you drink alcohol?
I'm drinking maybe half a bottle of wine, 5 nights per week. Sometimes more at the weekend.
So you are exceeding the limit?
Sometimes at the weekend, yes.
Yeah, but you know, sometimes this alcohol is harmful if you exceed the limit. So can you moderate your intake?
Okay, I know. I'm aware about that. Yes, I'll try.
Okay, and also smoking is harmful in general.
Okay,
Yeah, strongly advise you to stop smoking. That okay for you?
I will try.
You have any stress in your condition, in your life, sorry?
Only yesterday I didn't sleep well, as I told you.
Uh-huh. And how's your diet
My diet is good.
and your mood?
My mood is good also. We are celebrating my sister's birthday today.
Okay, and you have partner?
Yes, I'm living with my boyfriend.
Any other casual relationships? Sorry for this question.
No, I have a regular partner.
What's your job?
I'm working in the supermarket.
Okay. Can I examine you now?
Yes, okay.
By general look first, how she looks.
She look well, not cachectic.
Okay. Any fever recently, Miss Lisa?
No,
Any change in your appetite,
no,
your weight?
no.
Nothing. Okay. Now I will examine the all. If she's sitting, I will ask her to raise her legs and arms. Any focal segments or any lateralization signs? Any weakness?
No weakness.
No weakness at all. I
No.
will ask her to do pronator drift. Is it positive or negative?
Negative.
Negative. I will do tone power reflexes in the hands,
No, normal.
starting by the abnormal hand, the hand she had weakness before. Tone, the tone is okay.
Tone okay. Power is normal.
Power is normal.
Yes.
Then
These
the
are
reflex, she can do the reflexes.
reflexes are normal. Yes.
Yeah, so she can do coordination.
Yes.
Okay, the sensation, I will use superficial
And what
ones
test?
and
What
deep
test
one.
it was the coordination?
Coordination, I will ask her to clap the hand by
Mm.
both sides.
Mm.
She can do.
Yes.
Okay, the sensation now, I will use one for pinprick and one for the joint.
Good. Normal.
Nothing affected.
Mm.
Okay. In the face, any abnormal character in the face or any change in her facial look?
No.
Any facial deviation?
No.
Okay, I will examine one cranial nerve.
Mm.
So that I will choose the seventh. I will ask her to smile. Any deviation?
No.
Nothing. I will do cranial for hearing, if she can hear well in both sides.
Yes.
Is it affected, the hearing?
No.
Nothing. Okay, now I will examine for the mouth. Any
Nothing.
Nothing in the mouth, any soreness,
No.
any pallor and jaundice in her eyes?
No.
Nothing. I will feel the carotid for any bruit.
Good. No.
Nothing. I will also check the pulse. Any irregularity of the pulse?
Normal.
Normal pulse. I will auscultate and first detect the apex, and I will auscultate quick for heart sound. Any change or any added murmur?
No.
Nothing. How's the timer?
11 minutes.
Okay, I will examine now the legs, the
Mm.
same tone and power and reflexes.
Normal.
All are normal. I will
Yes.
do Babinski,
Down going.
normal.
Mm.
Okay. Do you feel any neck stiffness, Mrs. Lisa or
No.
Miss Lisa?
No.
I can do test Kernick tests to rule out neck stiffness.
Okay. Normal. Negative.
Normal, negative. Okay. If I still have time, I will offer examining the face for the eyes for acuity and fields,
Accuracy and field. Normal.
ophthalmoscopy. I will offer ophthalmoscopy.
No need.
No need.
Mm.
Okay. Um, I will do the last thing, the lymph nodes in the neck, cervical, auricular.
Normal. No.
Normal. Okay, what are your concerns, Mrs. Lisa?
I have two concerns. First one, I have this attack. It could be stroke. And my other concern regarding the birth pill. because I read about the birth pill. I should stop it?
Yeah, I appreciate your concern, Miss Lisa. For the first concern, actually one of the possibility you might had what's called mini stroke. It's not stroke, it's mini stroke. Means that there's some change or there's some block in the blood channel of the brain, temporary, which resolved later. And for the second concern, the birth control pills, yes, one of the possibility to be the cause of this mini stroke, along with the migraine, this pills. So I strongly advise you to hold these pills until we refer you to the woman doctor to find another way for the contraception.
Okay.
How does that sound for you?
Okay.
You
So
have
I
other
will
concerns?
admitted to the hospital. 2 minutes, 1.5 minutes.
Okay.
You
You
will
will
admit.
be, yeah, we will refer you to the nerve doctor. He will see you within a day, and he will run some blood tests and scans to your brain and scans to your heart, and also maybe they will do some tests for your activity of your brain. It's called EEG. Apart from that, he might reassure you that it might be something temporary related to the bills, and he can give you appointment for follow-up.
Okay.
Can I ask you one more question?
Yes.
You told me about migraine. When was the last attack of migraine?
It was 1 month ago.
Yeah, and it was controlled by the analgesia, as you told me, the painkiller, paracetamol.
Yes.
Okay. You have another concern?
No.
Okay. For meanwhile, I will again advise. Do you drive?
Yes, I'm driving.
Okay. Temporary as well. We can ask you to stop driving until reach to the bottom of this problem. Is that
Okay.
okay?
Okay.
And the same for the smoking and alcohol. Again, I advise you to moderate your alcohol intake
Fine.
and also to stop
Fine.
smoking. Time's up. Okay.
Okay. So present your case.
Yeah, Miss Lisa, 20 years old, presented with transient weakness in her left arm. Apart from that, it was floppy one. It lasts for few or short time, then it resolves spontaneously. She didn't have any convulsion with it, any sensation, affection with it. She's known migraine patient, and she is on paracetamol and some medication or herbal remedies, I think. And it was well controlled. The last attack happened 1 month back. Apart from that, I couldn't appreciate any neurological deficit or focal affection in her neurological history or examination. Her tone and power and reflexes and sensation coordination all went normal. No affection right now. So I can think about mini stroke related to her OCPs, which is combined pills, and it might be the trigger for that, along with the migraine.
Okay.
So on
So
top of my differential, this is TIA, transient ischemic attack.
and what? Any differential?
Yes, I can think about conversion disorder, function disorder due to hair stress overnight or the day before.
Hmm.
Yeah, this is my differential.
Any other differential?
Yeah, it could be migraine, hemiplegic migraine,
And why you didn't think about hemiplegic migraine?
because it's only one arm. It's not both side. I mean the legs and arm. It was only the arm. But
So
still,
it
one of the possibility, yes, hemiplegic migraine, one of the possibility.
could not be presented as only one arm weakness.
It's called hemiplegic migraine. That's why it's hemi in the all sides.
Okay. Okay, and what you do for this patient? Would you admit this patient?
I will refer her to the neurology urgent referral. So within 24 hours. Again, if TIA is suspected, I can refer her to the TIA clinic. We can do for her the workup. Also, they can give her some medication for migraine if it's hemiplegic migraine.
Okay. And what is the investigation?
Along with multidisciplinary team approach. Okay, the investigation.
Mm.
Most of the tests will be as routine blood test, only to rule out any metabolic cause. All electrolyte to be sure about any disturbance in any of the electrolyte like hyper or hyponatremia, calcemia, hyper or hypomagnesemia as well. Renal function and liver function just for checkup. And for the imaging, I can refer this patient for MRI if I suspect TIA. Then carotid Doppler along with Holter, ECG, echo, just to rule out any thromboembolic event. Thrombophilia study also, I could think to do it as a part of investigation.
Okay. Okay. Still time. Let me see. And just want to ask you won't admit this patient?
No, I won't admit this patient. I will not. I will refer her as outpatient clinic to the neurology.
You won't do for
Because,
scan now before the
yes, if I suspect hemorrhage, however, the weakness already resolved, so no role for the CT because I'm not suspecting hemorrhage.
not about the MRI?
Yes, we can do MRI within 24 hours after arrangement with the neurologist.
Okay. Okay. Okay, I
Okay,
finished.
multidisciplinary team finished the okay, only 10 seconds.
Yes.
I want to repeat the multidisciplinary team and other advice regarding or OCP and driving as yeah, that's
Okay.
it. Also
Okay.
some education about the condition for the cheese and the exaggerating factor or the triggers. Okay, your comment now.
This scenario is not TIA, it's hemiplegic migraine. It can come in one. It can come in one arm.
Okay.
So it was like this, and the patient was having pain in one arm, and it can come only one arm, or only part of the face, or only one leg. So it's not. It could come as weakness. So this patient has hemiplegic migraine, and which is triggered by lack of sleep overnight. So this is what she has. The second differential, as you said, it could be TIA, and also she might have carotid. She might have carotid this dissection, because in the hairdresser she might extend her neck, and this triggered the carotid dissection and the TIA. Okay, so this is the differential. You did it well. I will comment on all the things, but the only thing that I want to you for the carotid B, you didn't check for nystagmus in the eye, for cerebellar sign, because increase intracranial pressure pressuring the cerebellar, and Horner syndrome. You didn't check for any ptosis. You can say also for the carotid dissection or vertebral dissection, Horner syndrome. She might have ptosis or meiosis. Only this in the examination. You did Kernick and Brzezinski. You asked about the rash from meningitis, so you did all these things well. The only things for the patient welfare, you told this patient to stop the combined pills, but you should advise her to have safe sex till she will be prescribed another type of contraception. Okay, because this patient, you told her to stop the pills, she might be pregnant, so you'll advise her, you'll stop the combined pills, and you'll have safe sex with condom till you'll go to the woman doctor to can prescribe for you other type of pills or other type of methods of contraception. This is the only thing you should keep it in your mind when you ask someone to stop the contraception. They should have safe sex. Okay, this is my comment, but let's do it in the
Yeah, make it in the market. And I want to say something. Why the pregnancy is harmful for her? She might be happy with the baby.
she doesn't. She's taking pills, so she
Yeah, I know. But why it will harm the welfare?
it harm the welfare because this patient, if she will become pregnant, you pose her for termination of pregnancy, because here they are doing termination. Normally they are not accepting the baby.
Okay.
It was for her stress and in her life. So she will do termination of pregnancy because you didn't advise her to have safe sex.
Yes,
Okay.
yes, you're right.
So
Okay.
this is very important. Any patient you will stop the combined pills, tell her that you should practice safe sex till your human doctor give you alternative contraception and safe sex with condom only. Okay.
Dr. Basim,
Yes,
this
doctor.
This is a real exam scenario, and Dr. Sarah, she is very well right that this is the actual diagnosis, hemiplegic migraine, and it came many times. And then the other differential, the carotid dissection, TIA, and multiple sclerosis we can put at the end, because multiple sclerosis, it can present with any neurological problem. And in the history, what I felt that you did not take full history of headache, what type of the headache, whether it was pulsating, stabbing, it was increasing with something, decreasing. I think you took all these history or not?
No,
She said by herself that the headache is different, but it was all over. Yeah, but I didn't ask more. Yes, you're right.
Actually, this was the case of hemiplegic migraine. So you have to take all the history of the headache, whether more in the morning, increase with coughing, sneezing, bending like this, and what was the scale of the headache.
yes,
You're right. Yeah.
These were the things missing, and the real diagnosis is first diagnosis hemiplegic migraine. Then you can give TIA and carotid dissection, and at the end MS we can put.
Yes, right, Dr. Azhar. Yes.
Yes, I think you asked one question. Did you have any signs of infection? So the patient won't know what signs of infection. So I said no, but you should explain it. You ask in the history about the travel history and all these things. I think some of this history are irrelevant. You can ask about the headache itself. Yes, you ask about the weakness well and you examine it well. But for the headache, yes, you need to analyze it more.
Yes.
Yes, and you said you can ask her if you have, when you started sudden feel this weakness when you was extending your neck or not, to exclude the carotid and vertebral dissection. And as I told you, the Horner syndrome, because she might have posterior circulation affect the cerebellum. So I think also you need to check for the nystagmus for Horner syndrome. Okay. This is the things. So the main differential, first one is hemiplegic migraine, second one is TIA, the third one is carotid dissection or vertebral dissection. And other, the causes of TIA, stroke in young women, you should consider antiphospholipid syndrome, vasculitis, systemic lupus. It could be also paroxysmal embolism due to patent foramen ovale or ESD, but this is not relevant, but you can keep it in your mind. Only the differential is three things. But you did it well, but I think you asked a lot of questions about the other symptoms. You didn't analyze the headache well, but I know that you know it, because usually you are giving us this feedback about you should analyze the main complaint well. You was distracted by other things, maybe.
There is complaint headache in that scenario, or only weakness?
Having headache. I was having
Headache.
Yes,
No, I didn't read the headache. Really? Sorry.
Not in the scenario, but when I told you.
Okay. When you told me headache before, yes.
Yes, I told you I was having headache.
But I asked you if you have headache now. You told me no headache. That's why I didn't ask more.
But when I was having headache, I told you it was severe and not like the usual migraines that I have. So you should analyze it.
Yeah. Hi, hello. In fact, also, I just feel something. This is the important thing that you raised, that he's not analyzed the complaint of headache very well. But in this case, with the 20-year-old lady, I need also to roll out the very important thing, that subarachnoid hemorrhage and thromboembolic headaches, venous thrombosis. So this is very important to be rolled out first. That's why analysis of the headache itself is very important. That the severity of the headache, how it's severe, and is it the first time? And then I didn't hear any analysis about her previous migraine, because this is different one now. How this differ from the previous migraine. If I were you, I will ask about the different migraine, the previous migraine, how it looks like, and how this now different from the previous one. And then if I put the TIA, one of my differential diagnoses, I will ask about the risk factor, that if she has any palpitation, if she has any
You ask about
so analysis, what is the risk factor? You put the analyzing the complaint itself, and then what is the risk factor for this one? Then I will put, yes, you are right. It is the diagnosis now is the it's hemiplegic migraine. However, because it's a benign condition, I will put it down. I will not. This is like because hemiplegic migraine is the exclusion, is a differential of exclusion after to exclude the serious complaint. Subarachnoid hemorrhage, venous sinus thrombosis, and meningitis. After you roll out these main things, and then you put down despite this is the main complaint, but it will be down in my differential diagnosis because it's a benign condition. You understand what I mean?
Yeah. Thank you, doctor.
So
Yes.
the only thing that also I want to mention in this case, I'm not. It's not safe to let this patient go. I will admit this patient at least for 24 hours for observation. I will. It's not safe to discharge a patient with limb weakness, because in fact here they are not seeing the patient. We have no clinic like to see the patient over the first 24 hours. I will ask the neurologist to come in the MAU or in the ED to see this patient. If I want to start early discharge, I consider early discharge, but I will not discharge her home.
But the new guideline says that if you suspect, if you have a diagnosis of mini stroke or TIA, in spite of that, you will not admit the patient. You will never admit. This is from the UK guidelines. And then what you will do, you will take a neurology appointment within 24 hours. And it will be OPD appointment. Patient will go home and you will take appointment within 24 hours. And in the meantime, you will start 300 milligram aspirin for 2 weeks. And after 2 weeks, then you will switch on this aspirin to clopidogrel 75 milligram. And if the patient is allergic to clopidogrel,
yes, completely agree with the TIA thing. But this patient now, I'm not thinking about TIA.
So in spite of that, you will not admit this patient for the hemiplegic.
Yeah, I agree for the same point, because according to guidelines, why I will admit this patient, doctor? You mentioned it, even it was serious as TIA, I will never admit her. I will refer her to the neurologist within 24 hours.
Now she has weakness, yeah? She has weakness or resolve.
No,
resolve.
Okay, sorry.
No.
Sorry. If resolve, okay, I'm thinking that still she has weakness.
No.
Resolved. Within 1 hour, resolved weakness.
Okay.
Yes.
Only headache, Miss Lisa was heavy, still heavy.
Okay.
I think you are right, Dr. Azhar will refer her to the transit ischemic attack clinic. So she doesn't need admission. But I'm asking about the MRI. Does she need to do the MRI now to confirm the diagnosis of TIA or no?
She
Yes,
needs
within
for the
24
she
hours.
need an MRI. She
uh,
need an MRI.
for the TIA, the investigation of choice is MRI, not CT.
Yes, yes. I'm saying she should do it and then go home, or where? What?
No. In the OPD, you can take the appointment.
Hmm.
You can take the appointment within 24 hours. Within 24 hours, you will do the MRI.
Okay. And we will say that we'll start for her the asprin, or no need
Yes,
to.
yes. If we are
If you
suspecting
suspect, yeah, if you suspect, yes.
300 milligram aspirin, we will start and we will taper it. We will give it for 2 weeks, and after 2 weeks,
Dr. Aza, I remember 21 days, so 3 weeks. Then you can
no,
switch.
no. New guidelines 14 days. 14 days.
I will review it again because I share it to
You
the
will
group.
review, and then 75 milligram clopidogrel. If
Yes,
patient is allergic to clopidogrel, then you can give dipyridamole plus aspirin, 75 milligrams. Then you will patient will be back within 24 hours for the neurological assessment, and then you will also explain to the patient to avoid the risk factors like diabetes, hypertension, and dyslipidemia. And driving, if the
exactly.
patient is driving, you will stop the driving for 1 month also. In case of car, if the patient is driving car, you will stop for the 1 month. And if the patient is driving a heavy bus, you will you have to inform the DVLA and stop the heavy bus unless you will again reviewed by the DVLA.
Yes.
These are the new
Thank-
guidelines for the TIA.
Yes. Thank you, Dr. Azhar, for sharing this. And thank you also for
Because I have
Dr.
made this A, B, C, D. A, aspirin. B mean back to the neurology clinic within 24 hours. C mean controlling of the risk factor. D mean driving. A, B, C. A, aspirin. B, back to the neurology clinic. C, controlling of the risk factor. D, for driving. This is the treatment of TIA.
Yes, I agree. Thank you, Dr. So the mark, Dr. Sarah,
Okay.
you can put it.
I
I
think.
will talk about the combined contraceptive pills as triggers.
Yes, physical examination. I think we make it borderline because you didn't check for the nystagmus, and this is we're satisfactory. We can say satisfactory, but I think you should check for nystagmus. Okay. Identifying physical satisfactory.
By the way, the coordination of the hand, one of the signs for cerebellum.
Yes, also yes. Okay, so satisfactory. Okay.
Yes.
And
Okay.
identifying physical signs, satisfactory. Clinical communication, good, satisfactory also. Clinical judgment, I think borderline because he didn't say the first one diagnosis is.
But I am agree with Dr. I can't remember her name. She anyway. I mean, you have to think about the serious. So I can put it as second differential after putting the most serious in the top. This is the new trend in PACES exam. They want the most serious differential in the top. Then your case, even your diagnosis is still there as a second differential. Okay, I don't know if someone agree with
But
this point.
the feedback from the examiner, it was written diagnosis is hemiplegic migraine. Then
Yes.
you can, then below you can put the other.
Okay.
Yeah, you can mention it. You can mention, but we need to show while you are taking history that you are excluding the serious complication, because there is some complication can kill the patient. But hemiplegic migraine, it is a diagnosis. You mention it, but they will not stop you or say that you are not satisfactory because you didn't say it in the first.
No.
Yeah.
No.
Okay.
طيب
Because
Then
Dr. Bassem, what you want to
Ahlin,
put ahead of hemiplegic migraine؟ يعني انت
I
شو
want to
يبالك؟
mention TIA. TIA because
TIA. طب I will tell you one thing.
uh-huh.
Always when there is headache, think 100 times before saying TIA ahead of a hemiplegic migraine. It's a serious diagnosis, I agree with you. But whenever there is a headache in the scenario accompanied with the neurological symptom, TIA is a serious diagnosis, but it is less likely to explain a headache. And the whole scenario is about headache plus CNS symptom. So from this point of view, hemiplegic migraine have the priority because it really combine both. And then you can mention as a differential or serious thing to exclude TIA. فالonly issue is in the headache because TIA يعني is not something can fulfill or can present with headache. Okay? Usually this is the point behind keeping hemiplegic first one. يعني at least as I know يعني.
Okay, yes.
تمام.
I agree, Doctor, in this.
And this diagnosis, I think, borderline because you didn't
Mhm.
concern, you address the concern. The welfare, I told you, it's
About
border.
pregnancy. Yeah.
Yes, you should say this is not a good thing. And also because when you tell her hemiplegic migraine, you will tell her about the triggers, the lack of sleep, so you should avoid the triggers, and so you should talk about the triggers. So that's why the clinical judgment also will be affected.
Yes, agree.
Yeah.
Okay, thank you. Thank you, Doctor, for the case.
Okay, thank you.
I think also about the cheese and caffeine, other triggers, we have to mention it.
Yes, yes, we'll tell her about the triggers, about all the
Mhm.
stress, caffeine, flashlights,
Mhm.
and the food, some types of the food. So we'll explain for her briefly if you have confirmed the diagnosis confirmed.
Yes, okay.
Now, what about the alcohol? We will stop alcohol or red wine?
Red wine.
Red wine. Red wine is the trigger. Lack of sleep, red wine, chocolate, cheese, heavy exercise, hunger pains, and extreme exercise.
And
Yes.
menses is always important. OCP and menses.
Yes, yes.
Combined, yes. Combined is OCP.
OCP
And
and menses. And I don't know why really some people they value too much the question whether the headache is related to the cycles. Because as simple as like you can reassure the patient يعني, because it's related to the cycle, nothing to be done. So usually it help you in explaining the condition. So always they like this question whether the headache is related to the cycle, and if there is OCP, to stop the OCP.
Mhm.
Dr. Mahmood, we also want your input. Why you are not talking?
Yes,
You
yes, I
should
am.
participate.
I have,
You
I
must
have.
relax. You must relax.
Yes, I have question. I like this case really.
Yes, we want you.
I
You
have.
should be happy. You should be. Don't take any tension. Inshallah, everything will be good. Just relax.
Thank you, Dr. Azhar. But I have question, Dr. Sarah. What if Dr. Basim analyze second headache and why it is severe, more severe than before?
Good question.
Yes,
Why different character? Yes.
why different character? You told that the headache is
I
most severe than the previous headache
Um,
that I have.
Exactly.
because it's become as hemiplegic. She didn't have hemiplegic migraine before, so it's this combo. That's
But
why I thought
but migraine come first and then the hemiplegia.
she has this migraine. Now she has hemiplegic migraine, so she has a new presentation with different type of headache and weakness.
Okay, but
usually الهيدك تبع المايجرين الكلاسيكال
Same.
is more يعني بيكون أحيانا under control.
And she know
When it is out of
Yeah.
control معناتها تغير the variant of the migraine changed.
Yes,
So it become a hemiplegic migraine rather than the classical, her usual classical migraine. Okay, so you are expecting sometime increase in frequency, unresponsiveness for medication, because if you remember beta blocker is not anymore an option. So usually she was, for example, on beta blocker, she was doing well. Now still she's started to have headache on top of her prophylaxis. So you will find 3 points: severity of headache, frequency of headache, responsiveness to the medication have changed along with a new aura or symptom, which indicate انه الفاريant or the classification of the migraine has changed. Or how you will know that it has been now having different type of migraine? By these 3 information, one of them will be positive يعني,
okay.
as a
I think
change in the nature.
maybe
So
the contributing factor is the OCP. Maybe she
but
is taking OCP
the-
and OCP is
it was
contributing.
And the stress
it's,
itself may trigger it.
taking because I get this scenario from her. It's written that she was taking the OCP for 5 years. So I think because I'm working in the sexual health, so for combined pills, there is a UK MAC classification to give. It means that we can give if there is absolute contraindication for combined pills or relative contraindication. So migraine only is relative contraindication. So you can give, you can weigh the benefit. You can give.
Without aura.
with
Without aura
aura,
is relative, I
yes,
think, but with aura is
yes. I'm
absolute.
saying that with aura is absolute contraindication.
Yeah. So
Without
you have, that's why
relative.
the aura, I think it make a big difference in your decision.
This is the thing. And the other thing, maybe because we will tell her to stop because she has this it's the scenario. It's written that she has the migraine and she's taking the pills all the time. She might not have the aura. That's why they give it to her. The other thing, because she has hemiplegic migraine, that's why we might ask her to stop the pills. This is my analysis for this scenario because I didn't invent this scenario. It was like this. Maybe
Paces wise, I advise you people all, irrespective of the type of migraine, if you don't want to stop, you have to mention we need to review your OCP. يعني migraine is usually part of the judgment when they bring migraine are the triggers, the medication overuse headache, and the OCP. يعني these 3 points usually they run around in their migraine scenario.
I
So
think
always
we use combined pills, and better to hold it till you will get.
Yes, I agree with you. Until she get reviewed by the neurologist, we classify her migraine. We review if we can have another safe option, and all those combined information we can decide on her OCP. So holding or reviewing the OCP is always a good thing to be done, irrespective of the type, irrespective of your initial assessment for her migraine, without aura, with hemiplegia or whatsoever. يعني at least so you can ensure your judgment will not be affected.
Yes.
So what is the character of second headache? Sorry, Dr. Sarah. It is the
That it is severe. It's on the right side. It's not throbbing. So this was if he will ask me, I will analyze it like this.
okay, and there is aura. It was aura.
No aura. He asked me about the aura. There was no. So
Okay.
aura for this migraine.
And severity.
Okay.
What is severity?
He didn't ask.
So what was the severity?
6 or 7, but she doesn't have this headache now. So I think I don't know.
Dr. Memo, you ask what is the character? Character means what it was pulsating, stabbing.
Yes.
So migraine is always pulsating,
Throbbing.
and cluster headache is always stabbing.
Yes.
And then tension headache is band-like headache,
Yes.
band-like headache.
Yes.
And then this joint cell arteritis headache, it is throbbing. If the patient gives this, you must ask the character of the, like throbbing means joint cell arteritis. Then your diagnosis mainly towards the joint cell arteritis. Then you will rule out other. If pulsating, it is migraine. It is stabbing, then it is a cluster headache. It is band-like tension headache, like this. So character you must ask in the history. It's very important.
Yes.
Okay, nice discussion as usual. Any question else? Thank you, Dr. Azhar, Dr. Hind, and Dr. Mahmoud. Of course, Dr. Sarah for the case.
Okay.
Anyone want to clarify or to ask or to add comment?
Usually they ask whether CT or MRI is indicated, okay? And usually they ask what are the allowed or contraindicated medication. يعني how do you treat hemiplegic migraine, and what are the medication you should not give? For example, beta blocker, OCP, triptans. Those are all like unfavorable options. There is one variant of calcium channel blocker, flucirrazine, something, well, I forget, but it's a calcium channel blocker. They prefer it in hemiplegic migraine. And also, whenever it comes to hemiplegic migraine, you can mention things regarding the secondary prevention similar to stroke. يعني if there is weight reduction, if there is dyslipidemia, if there is smoking, because they help somehow in managing the hemiplegic migraine. And they ask about the imaging, the contraindicated medication, treatment regimen, and they prefer also prophylaxis. I remember calcium channel blocker can be used for both prophylaxis and treatment of the acute attack. Actually, we have to read again about hemiplegic migraine. There was some tricks, يعني better to know what they are using.
The
And
friend
whenever it, Mhm.
calcium channel blocker we are using prophylactically for the cluster
Yes,
headache. Cluster
but
headache,
also
not for this. Before
this
it was
special.
using, now we are not using for the migraine. And what about the beta blockers? Beta blo-
No beta blockers
when it was banned?
contraindicated in
When
hemiplegic
it
migraine.
was banned, because I have read the
Mm.
guidelines. If the patient is pregnant, then now the UK guideline they recommend only two medicine for the prophylaxis. One is the beta blocker, other is topiramate. If female is pregnant, you cannot give topiramate. You will the
Yes,
choice is
but
only
I'm
beta
talking,
blocker.
Dr. Azhar, about hemiplegic migraine. The guidelines for hemiplegic migraine, it's totally different from the classic. Whatever
Okay,
you are reading, I remember,
okay,
yes,
yeah,
and amitriptyline, acupuncture, it was all mentioned. You are right, but for hemiplegic migraine, totally different. And usually they love to ask about those differences in the management. So there is a type of calcium channel blocker which is not verapamil. Even the name of the medication was a strange one, but the class is calcium channel. They prefer it as a vasodilator because calcium channel vasodilator, and the main mechanism of hemiplegic migraine is prolonged vasoconstriction. So they
yes,
use it for acute treatment and for prophylaxis. And they prefer to give a very strong prophylaxis, I mean, to prevent the attack of hemiplegic migraine rather than treating it acutely. So it's always when they ask you what are the indication of prophylaxis, hemiplegic migraine is from the first attack. It's enough to start prophylaxis because it's always better to avoid the recurrence of those attacks. It might end with a stroke. So this is one of the question, the imaging, the treatment, and what else they ask.
Topiramate, Dr.
Any
Hind, one of the prophylactic for
classical
hemiplegic. Yeah.
migraine, but not hemiplegic. Okay,
That's for the
hemiplegic.
migraine.
Yes,
Yeah.
yes, not topiramate. If it is a male, it's always easy to mention, but topiramate never mentioned in a childbearing age. يعني if you were
yes,
asked what are the prophylaxis option, you will start with beta blocker in evident by her age. What are the other options? بتقول له topiramate, amitriptyline, some non-pharmacological treatment. They are used. حتى أعتقد بيستعملوا الريبوفلوفين, one of the vitamins. So the guidelines are giving you a lot of options. But for hemiplegic migraine, we have to read. وإن شاء الله لو قريت, I will share the acute treatment and prophylactic treatment. And if I find any extra question, also I will share it. I remember one very important differential, but be careful before considering it. Always headache and weakness in young age, you should remember dissection. Okay? Some meticulous examiner, he will tell you what else you need to exclude. So if you didn't find any other red hearing things, tell him dissection, but don't go into CTA, اللي هي الانgios studies. But some people they love to hear dissection because it's common in young. It is
yes.
associated with headache. It is acute
Vertebral
and
basal dissection is very important. Vertebral basal
yes,
dissection.
yes, and it lead really to a very similar presentation, and it's a red hearing diagnosis. So please remember always dissection. Don't be so don't be too much into the investigation of dissection, but remember it as a differential. Okay.
You are, you are right. You are right.
Yeah. And the question for trauma is enough or still need a specific trauma, extension of the hand?
لا, if he told you, if there was vertebral, يعني if there was a history of trauma and there is some dysarthria, drop attacks, nystagmus, those symptoms of the brainstem, at that time it's good to know what are the triggers. So here asking about the type of trauma is a kind of recognizing a trigger. So you can ask the patient to stop. For example, if she told you I play yoga, So you will advise her to يعني train herself by using different exercise other than hyperextension. If he's a car mechanics, he have to give up his job because he cannot continue hyperextending his neck. If she's a person who was cleaning the ceiling, then you have to tell her she's not she shouldn't do it again. So it will be a kind of recognizing the activity to prevent her from repeating it. not يعني you get me. يعني انت متى ما عرفت انه vertebra
Yes,
فبدك
yes.
تسأل عنهم لانه صار اهميتهم مو بس بالهيستوري، صار اهميتهم كمان it's having another importance now to explore the type of the trauma. Okay, to give her advice.
Likewise, in this
So
scenario,
hyperextension,
the patient went to a
hairdresser.
hairdresser,
Yeah.
and hairdresser they are
Yes,
also
that's
doing the
why this scenario is very common and very tricky because also the position she was adopting when she get this headache was a kind of a hyperextension of the neck. So, and
yes.
young patient. So dissection is always a valid differential. Okay.
Oh,
This is
okay.
great differential, yeah.
Yes.
Mhm.
Yeah. Thank you, Dr. Hind. Nice
العفو.
discussion as usual. Yes. Some Dr.
عقدت لك
Ayan.
عقدت لك الموضوع بس حقك علينا.
No. We have to know the serious and the most specific the differential I like in this patient. So Dr. Ayan wrote flunarizine, calcium channel blocker for prevention. Yes, good to know.
Fluranizine, yes. This one.
Yes.
Okay, this is the best treatment for
Yeah.
hemiplegic migraine.
Okay.
So, Doctor,
Any added point?
yes,
Yes.
Dr. Hind, how to exclude dissection from the history when we take the history?
Trauma to the neck is the major thing. His hobbies and his job.
neck extension.
لأنه sometimes yes people they don't consider yoga as a trauma. هلا هذا أنت you will ask after you will get a brain stem. يعني there will be some dysarthria, there will be dizziness, there will be drop attacks. تمام. فthose D's بيسمون D's of the
You
posterior
mean
circulation.
cranial nerve affection?
Yes, so you will have, for example, dysphagia, dysarthria, dizziness, drop attack, nystagmus. So those presentation, if they were there in this patient, even if dizziness alone, okay, so dizziness
Yes.
plus numbness plus weakness plus changes in the speech or this dysarthria, so you will have to consider those risk factor. طبعا as I told you trauma by itself is a very يعني والhistory will be acute. Here the beauty of the history إنه there was a migraine. Since there was a migraine and there is a headache now,
Yeah. So
you
it's
have
out.
to correlate more with the past history, taking past. But in case of vertebral dissection, this type of
Will not resolve.
history will not be there. So the first time he will experience this symptom. So either trauma or cleaning the ceiling, yoga, those things where you and you have
And
to.
and the symptoms will not be resolved, Dr. Hind.
Mm?
The weakness, the
لا
symptom will
it
not be resolved.
resolve بالدايسكشن. it's either continuous or intermittent. لأنه أنا حقول لك شغلة، أنت منين بتجيك السيمتوم؟ why you get symptoms؟ الدايسكشن
The
by
showers.
itself is the yes showering from the false lumen. والfalse
Mhm.
lumen is always not big enough to make to form a big thrombus.
Okay.
Okay, so there will be a kind of showering on and off. ولحسن حظ المريض إنه it is like this.
Mhm.
تمام. So it depends on the size, extent of the dissection, severity of the trauma. So it can be يعني this is very important point, can be continuous يعني خلص اجت وكانت القاضية، أو it can be showering. Okay,
Yes.
resistant or on and off. Okay.
Yeah. Okay. Clear now, Dr. Mahmoud?
Yes, Dr. Basim, but sorry, last question. So we will do any investigation to this patient?
Regarding dissection ولا regarding the other differential?
No, the case. The examiner told you. What will you do to this patient?
Will be
You will
routine
deal with it.
investigation.
You will deal with it as it is a very risky type of migraine. نحن بالعادة in the migraine we always say whether we do CT ولا we should not. At the end we
Yes.
say it can be as a baseline, no need to do it now. النيورولوجيست حر امتى ما بده بيعملها، لكن as a current investigation no. But in this case you have to do brain imaging. تمام. You have to do brain imaging. You have to exclude the risk factor تبع TIA, irregular workup like the dyslipidemia, like the diabetes stuff, uric acid, those things. And you have to make sure يعني if he told you what else is a dissection came into the discussion and it was a valid differential, then you have to add some angios
Angio.
or
Yeah.
carotid,
angio.
yes, or Dopplers.
Mhm.
Not carotid
Yes.
Doppler, as said Doppler العادي اللي هو الارتيريال Doppler أو any angio study whether CTA or MRA. If she is a female, don't forget to exclude the venous CVT.
Thrombosis. Yeah.
Yes. So sometimes if she's on OCP, you can mention CTV with full confidence. تمام.
Yeah.
So CTV is very important. Angios are very important if discussion. The brain imaging is very important. We'll work up for any cardiovascular risk factor because TIA stroke are major differential. ويعني I think يعني this is what is in my mind mainly. I don't know كمان
Yes.
بما إنه ما شاء الله دكتورة سارة يعني if she did the case or
but
if she have any feedback.
the,
Is there something written extra, guys?
I think
يعني
only in this
mention it.
scenario this patient wasn't the hairdresser, so the dissection might have because neck extension. So we need to ask her about the position because this scenario might come by neck extension while she's doing her hair.
بس something else يعني just one point. في أحد الأطباء عمل الكيس بمصر و it was, do you know, everything negative, just mild numbness after the headache with some weakness which resolve in a second. So when he mentioned CTA, the examiner was like, are you over investigating?
yes,
فبس
that's
فبس
my
take
question,
care.
Dr. Hind.
ايه
This case,
take care of the reaction of the examiner. يعني حتى when you mentioned the dissection workup, if indicated الله يوفقك. حتى هو إذا من النوع اللي he hate ال over investigation, just he will not get irritated لأنه أحيانا في ناس بتسود لك عيشتك وقت أنت you over investigate. فبي هيك وقت بتوقف عند الدايك قولها أنجيو على استحياء if indicated. لأنه
Yes.
sometimes it's a very straightforward hemiplegic migraine, very simple CNS
Yeah.
symptom,
So
no
no need to go
trauma,
further.
no dizziness. فبحسك وقت بتقول CTA وكأنك فهمت علي يعني you are showy, too much showy. فبليز بس be careful. I
Yes.
faced this إنه one candidate really he lost the يعني he lost the trust of the examiner when he rushed to the NGO. So you will mention them at the end and you will mention the word if indicated and يعني هيك على استحياء. Okay?
After neurological opinion. Yes.
Yes, something to show the examiner that you will not jump to that
Yeah. You
extent
will not do
except
it by
if
yourself or you will
indicated.
decide for it.
Yeah, okay.
Yes.
يعني I
Yes.
always love those experience لأنه they teach us about the variation between examiners.
this case, Dr. Hind came before in Egypt, and the examiner told the candidate, what's your diagnosis? Only that. The candidate told that it is hemiplegic migraine. So the examiner told him, what is the investigation you will do? Just he tell CT. قال له, oh, what you will CT for migraine? Really,
Hemiplegic.
hemiplegic
But
migraine, no
hemiplegic you have to
investigation.
do.
But you know, the same examiner told another candidate, so what's your differential diagnosis? He told him hemiplegic membrane, TIA, and anything. And then the examiner told the candidate, what is your investigation? He told no investigation. Told him why you tell the differential diagnosis, not the
Wow,
diagnosis.
يعني I get you. So see how the examiner is
Yes.
clever, is making you pay the cost of your differential. If you
Yes.
miss the correct differential, then why to add investigation, which is
Yes,
not necessary.
that's
But
the point.
at the same time, if your differential, including serious differential, so you have to investigate. So it's a kind of a lesson for us. Your
Yes.
differential diagnosis should match your investigation list.
Yes.
Okay, there should be some logical matching between your differential diagnosis list and the investigation you are ordering. So if you were very good and you mentioned dissection, it will be justifiable to mention angio after neurological opinion or if indicated, and as I told you, arrange them according to the priority of the differential كمان. يعني it was really nice thing to share with us that the same examiner had different response
Yes, the same
for the
examiner.
same investigation.
Yes, he play in this point. He told him what is the diagnosis. Only that hemiplegic brain. If the candidate told that it is TIA, so okay, no problem. He will tell CT.
indicated.
Yes, or
لا
stroke.
هذا examiner ترفع له القبعة. مركز مركز بالحرف.
Yes.
الله يساعدك يا رب.
Okay, best of luck, Dr. Mahmoud, inshallah. Any other question, any comment?
Dr. Basim, I missed the station today.
Oh my God,
I
Dr.
was on the
Mahmoud.
train. Anyway, but you have to mention TIA with hemiplegic migraine regardless.
Yes,
Because the reason of hemiplegia is either stroke or
يقوم
spinal cord or
يقوم لي
sustainable.
تحت يقوم لي أحمد.
لا
Yes.
لا انا جاي لك من المستقبل. انت مش هتلحق تقول حاجه اصلا في الامتحان. انا واخد لسه عامل موك تيست دلوقتي جاي من لندن. ما بتلحقش تنطق انت الاكزامينيشن اصلا يعني الموضوع مش زي ما انت متخيل. يعني انت مش هتلحق تسال حاجه اصلا.
Yes, I know. Today also I have a course of
يعني
mock. Yes, I know.
الكويستشنز لا أنا قصدي
Today also I have a course
الهيستوري
of
اللي
mock.
احنا بنهري فيه ده كله انت مش هتلحق تساله.
Even the examination, Dr. Basim, you will
ولا هتعرف
not.
تطلع
Yes.
ساينس.
Not science, the full examination. You will not do all this examination.
بس انا عامل كل حاجه في الابدومين النهارده واخد فيدباك بوردر لاين عشان خاطر ما بصيتش على الباك ان فريكتوم سكار.
Yes, it is
yes,
fatal.
this is
Fatal
very
mistake.
important. Yes,
فتل ايه
It
يا
is
عم؟
fatal mistake.
unsatisfactory. Sure.
Yes, you
Yes.
have to sit the patient and look at his back. Yes.
يا انا يعني في غايه الاحباط. ما تقلقش،
No, no
مش
need,
هتلحق
Doctor.
تسال حاجه في
You know,
Dr. Mohammed. No
Hmm.
need. You have to learn from this mistake before exam. In the exam, you will feel regret if you didn't practice this before, right? So better to learn now. In the exam, you will be more depressed
فعلا
if
مفيش
you
وقت
miss.
يا دكتور. نو تايم.
with
انت في
practice
الاب.
will be easy, Ahmed. With practice, really. With practice will be easy.
أنا هذا اللي كنت بدي أضيفه، إنه عن جد ما كتير تتشائم، لأنه أنت هدفك من
Yes.
البراكتس
Yes.
إنك أنت توسع مجال لكل هالأسئلة غصب عن الساعة وغصب عن الزمن، شاء من شاء وأبى من أبى، لأنه هذا هو هدفك. عم تسهر وتقعد وتفتح زوم، ولا
Exactly.
كنا
Yes.
كلياتنا يعني كلياتنا قعدنا بالبيت حفظنا الأسئلة وتوكلنا على الله. فأنت لما حدا عم بيحط لك 15 دقيقة وانت كل مرة عم تبدأ وكل مرة عن جد عم تلاحظ حالك انه اول مرة خلصت عند 18، تاني مرة عند 16، تاني مرة عند 15.
Yes,
يعني
sure.
انا اسوأ وحدة بالتايمينج واجت علي فترات اخلص بال14 منت. فيعني اياك تيأس من هالموضوع. و I attended a history of people، والله لا انسى انه ما نسيت ولا سؤال، وكانت بالشورت ستيشن وقت كنا 8 minutes، ولا زال دكتور KGI يذكر الأسماء لأنهم كانوا ناس رائعين، على راس لسانهم السؤال. وإذا كان السروجت حسك إنك أنت سريع بيتجاوب معك تجاوب جدا فنان. يعني ما حدا حيقصر بحقك
دكتور هند، هو
لو أنت
المشكله عندي
حافظ
اكبر من
الأسئلة.
كده. المشكله اكبر من كده عندي في اليوكي. المشكله ان العيان ممكن يقول حاجه انت ما تفهمهاش. ف
هو
ف
هذا سبب ثاني إنه يأخرك بالهيستوري فتعيد عليه السؤال. صح كلامك.
صدقيني ما فيش وقت. صدقيني الكلام ده كله هو
بس
استيميتد.
أنت
المفروض
حتتعود
الهيستوري
على الأكسنت،
ماكسيمم
والله
8
حتتعود
دقائق.
على الأكسنت تبعهم، صدقني هتتعود على الاكسنت تبعهم. ما
عموما الواحد
حتاخد
عنده
منك
امتحان
وقت.
بقى. انا امتحاني بعد اسبوعين عموما يعني. فهو ما الحمد لله يعني.
دكتور
ان
على
شاء الله
قدر.
كل هالتشاؤم يتلاشى
Yes.
دكتور احمد
إن
باذن
شاء
واحد
الله.
احد.
Yes.
الله يبعث لك
Yes.
سروجة انجليزيته واضحه.
Yes.
وبعدين
Exactly.
نصيحه، ابدوا بسرعه من اول ستيشن. دائما بنغلط هالغلطه، بنجي بنسال على البريفيوس والأونست بهدوء وبعدين بنعجل تحت. انت استنفر، يعني اعلن النفير العام من اول سؤال، لا تستنى لحتى تحس
Yes.
حالك تأخرت. بالعكس،
Exactly.
البريفيوس والأونست والديوريشن هدول الموست سمبل ستاف تو فينيش ذم كويكلي. يعني انت حتاخد المفروض وقت بانك تدور على السيستميك سيمبتومز اكثر، فحاول انك تستغل الوقت من اول لحظه. من اول ما بتطلع بالبيشنت ابدا اسال بسرعه
Yes.
وخلص الجنرال اناليسيس فيري فاست.
Exactly.
ونسال شويه اسئله مع الاكزامينيشن، السموكينج، الجوب،
Yes.
الامباكت، with
Yes.
whom you are living. هي الأشياء اللي أنا مالي يعني ما بدي أتركها بذاكرتي. خلص smoking stop smoking. alcohol except if it is related. impact يلا آسفين we will offer you help. فهي نوعا ما سهل إنك أنت to address while you are examination. it don't need concentration. ما بدها حضور ذهني يعني. فهي هدول التو تكنيك إنه نستنفر من البداية، نسأل بعض الأسئلة أثناء الإكزامينيشن، يعني
Yes.
very helpful in saving your time.
Yeah. Plus, Dr. Ahmed always judge on your effort, not about your studying or your knowledge. It's effort-wise. If you did your effort and you did what you have to do,
براكتس وتعبت
of course
والله
it
بدك
will.
تاخد
دكتور
بالك.
باسم، الواحد ما عندوش مشكله في النولج، مشكله في الخضه بس.
No
يعني مثلا
problem.
دلوقتي في النيورو بيجيب لك unable to walk، ما بيقولكش examine لا upper limb ولا lower limb ولا cerebellum ولا باركنسون. تمام. unable to walk examine neurology. تمام. دي في حد ذاتها
Yes. No.
مشكله.
One test in the beginning of your station. Just to do one test. Ask him to sit and raise all limbs.
نو
Or
لا هلا
walking.
تعمل
Ask him.
جيت.
I prefer الجيت
هم قالوا
يعني
جيت.
لأنه
جيت
Okay, great.
جيت
Okay.
جيت هتلاقيه اتاكس في الجيت اكزامين السيربيلم، لقيته شافلينج اكزامين
Exactly.
الباركنسونيزم،
جيت باركنسون.
لقيته سيركمدكشن اكزامين لور ليمز هيموبليجي. فهو دلوقتي بيجيبوا في السيشن نيورو انيبل تو ووك، اتفضل اكزامين النيورو، وتساله يقول لك ما اعرفش.
Yes, but
كم موك حتلحق تعمل دكتور أحمد قبل الامتحان؟
انا
ولا موك
شايف
واحد؟
17 عيان النهارده، منهم حالات للرير وحالات مش رير، وشايف حوالي امبارح 11 واول 8 بس. يعني يعني بصراحة هو صعب ان انت تشوف سكار في الرايت ايديك فوسا وسكار في الليفت ايديك فوسا وسكار فوق الرايت كمان. فالعين عامل ترانسبلانت فيلد وريسكتد، خدوا الجرافت
دبل ترانسبلانت.
وعمل ترانسبلانت في الليفت. تمام. وفيلد، وعمل ايه في فيستلا، وعمل نيدلينج فغسل امبارح، وجالك عين تاني بنكرياتيك ترانسبلانت
هلا شوف، أنا بدي أكون صريحة معك. اليوكي إكزام لا تقارنه بأي إكزام على وجه الخليقة. نحن لا في عنا ما في عنا مالتيبل سكارز، ولا عنا الواحد بيعمل ترانسبلانت مرة واحدة بحياته
عايز
يعني
اقول لك
يحمد ربه.
انا ما شفتش السكار بتاع اللانج ترانسبلانت، وانا متاكد ان العيان ماشي على الستيرويدز عشان في حاجه، وهي ستيشن شيست، من كتر ما العيان فاتح قوي والسكار مش باين خالص.
صار very
وتحت
well
البريست في
sutured.
ليدي ست وتحت البريست، وخليتها ترفع البريست وما شفتش السكار برضه. انت متخيل؟ ما شفتوش من كتر ما هو فاتح.
but at least you learn these
يا باشا
things.
ليرن كواركتيشن اوف
خلاص.
ذا
You
اورتا.
will not be surprised in the exam.
والله
At
ما
least
شفت
you learn
السكار،
it.
انا واقف على الرايت
But
سايد.
you learn it in the exam. You will know what to do. I will
ده املي
raise that.
بقى.
حلو
This
دكتور
is my
احمد
hope.
انك انت شو عم بتقول كلمه حلوه، انك you were expecting. فما شاء الله الكلينيكال سنس تبعك. يعني واحد عم بيقول لك انا عم دور على السكار، بس انه هلا حتتعود على شكل السكار بالناس الفاتحه
Exactly.
مع
That's
سوتشرينج
why. Yes.
بيرفكت. فهلا انت لو انا ورجيتك هالعيانه مره تانية نفسها، حتقول يا الله السكار واضح، انا ليش ما شفته اول مره. هي بس انك تعود. انت ترى مالك متعود على هالنوعيه
Exactly.
من
Yes.
الهاي كواليتي ميديكال كير.
Yes.
فانت بالنسبه لك بكره هالمنظر هاد حتلاقيه جدا عادي.
usual. Yes.
عايز اقول
حتحصد ثمرة هالكيس
الباركنسونيزم
صدقني.
ما كانش باين برضه.
Because
الباركنسون ما كانش باين، ما كانش
كنترول
ولا في
controlled.
اصلا
Yes.
تريمورز.
Controlled. Patient they are on medication and you want them to be not controlled in UK?
لا انا عايزه كنترولد، بس انا ما البس.
No. I mean in the care, as Dr. said, Dr. Henson, the care of service there in UK very good enough to make the patient well controlled. The scars, okay,
Yes,
nice. Yes.
Dr. Basim.
But in Egypt, you have patient.
Yes,
might
today the patient was asthmatic or
you can hear
fibrosed.
it from
Yes,
the door.
I told the patient, you are in nebulizer. Told me, yes, I am nebulizer, but I stopped it since 2 days due to the course
For
and
the exam.
for the exam. Really?
This is the service of care of service.
And the مريضة تانية غريبة قوي. The patient stopped dialysis since 4 days for the exam.
يا حرام.
لا
Stop
حول ولا
dialysis,
قوة
doctor.
إلا
Really, أقسم بالله. Stop
Yes,
dialysis.
because she
and
will
the
get
patient,
money more than what she will get
yes,
from
patient
anything
come.
else.
I see this case since last week in the course, normal course. So I say here today, have ascites and buffness eye. I told her why. Told me I stopped dialysis since 4 days due to the exam.
I told you about the thyrotoxicosis patient. I saw him before.
Yes, yes.
Exophthalmos, proptosis, everything in the manifestation
As
of hyper or
book,
thyrotoxicosis.
as the book.
Yes.
Yes,
And why I ask one question: why he is not controlled? He's not taking the medication to to pick up the finding for you and to get more money. The question, no need for more talk. Yes, I think full stop. No comment. Wallah. This is the difference between us and UK. Okay, well done, Dr. Ahmed. Don't worry. You will
don't worry,
learn
Ahmed.
these things.
Yes.
Yes, and Dr. Mahmoud the same also. You will learn
No,
all
no,
these things
yes.
now, but better
Uh,
than in the exam.
take beta blocker,
Okay.
Ahmed. Tomorrow I will I will buy beta blocker. Ready. I need it.
Yeah, better if you are stressed and no
Yes,
sleep,
yes.
you can take it.
I can't
Okay.
sleep.
لا
Okay, best of
أمو ما
luck
في
all
شيء
of
اسمه
you.
I cannot sleep. مو نصيحة حدا ما ينام قبل الامتحان.
Yes.
Yeah,
والله مو
we tried, Dr.
نصيحة.
We mentioned. We
يعني
said to him.
تراي قد ما فيك وعادي يعني صدقني
Yeah.
يلي حيجيب لك يا النوم ما حيجيب لك يا السهر. فما
Yes.
في داعي للقلق وبعدين ما شاء الله يعني والله اللي عم تعملوه مو قليل فرب العالمين ما بيضيع تعب حدا
آمين يا رب.
فتوكلوا على
آمين.
الله.
آمين يا رب. آمين. Okay. Any other question related to the topic today? Hemiplegic migraine and multiple myeloma. Okay. Thank you, everyone. Dr. Sarah, Dr. Mahmoud, Dr. Hind, Dr. Azhar, and Dr. Ahmed, Dr. Ayan. All of you, thank you for attending the session. We'll see you tomorrow, inshallah, with Communication Day. I can end the session now. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. شكرا دكتور هند وإياك يا رب.